Hello, my name is Eddie Reyes and I'm with Preferred Physicians Group. Today I want to talk to you about what we do and what we do not do. First, we're going to talk about what we do not do. What we do not do is we don't partake in anything fraud related relating to your insurance company if you were involved in an auto accident. We will never be involved in a stage accident. We've helped thousands of patients within the 10 years that are legitimate. We help them receive, work with their attorneys and help you receive money from your settlements as well. We will never pay a patient to come in for service. We feel that if we provide a good service, you want to come in. We should not have to pay you to come in. And again, it's a fraudulent account towards ourselves and for you as well. The third thing we do not do is that we do not do any signing and driving. We do not have patients sign and not show up. We really do care about the patient. We want you to feel better. In addition to that, we want to make sure that we don't partake in anything fraudulent. We've been doing this for a long time and we want to continue doing business. The other thing I wanted to talk about was that whenever you deal with the big producers, the people that advertise a lot, the reason why they advertise a lot is because they need higher production in order to pay for the advertising budget. When you come to our office, we really focus on you, the patient. Our business is small. We've been doing it for since 2000. And since we've been doing it for so long, we don't have the advertising budget like some of the major competitors, but we really do focus a lot of time on patient care and make sure that you're doing well and you feel great and you refer other people. So if you have any questions or if you'd like to know more about my business, please give us a call at 868-4357. Thank you. We're here with Dr. Castleman. He's going to explain to us what chiropractic is and how does it benefit people.
Chiropractic is the specialty field basically that deals with the spine and the spinal relationship in patients that causes or alleviates irritation to the nervous system. The nervous system is known as the master system of the body. It controls not only the function of the body as far as the bone-wise, but also it influences the way that the muscles act, as well as the circulation throughout the body as well. Whenever there's irritation being placed on any parts of the nervous system from any type of misalignment of the bones of the spine, that area where it is being misaligned isn't going to be able to function at 100%. Our goal with chiropractic is to alleviate that irritation and allow that area of the body to function at its maximum potential. Very often, especially with any types of traumas or accidents, those areas can become misaligned due to muscles going into spasm, pulling the bones of the spine out of alignment and causing that discomfort and that pain in that area. Our goal with chiropractic is to relieve that misalignment, allow that body to function in that spot at 100% and get that irritation off of the nerves of the spine. We also deal a lot of times with the discs that are in between the bones of the spine, because they're very often with a trauma can become inflamed or what we call bulged. Sometimes, unfortunately, they can become bulged to the point where they herniate or tear. In that case, we have certain types of treatments and protocol that we recommend to help with that relief of those problems, and that's why we include a few different types of therapies in with chiropractic to use in conjunction with what we do when we realign the bones. That includes, but not to be limited to, some massage work and other types of therapeutic adjuncts to alleviate those areas and allow the patient to heal, as well as that pain to go away as quickly as we can, as quickly as the patient's body can respond, or sometimes we have to deal with it as slow as their body responds, because every patient is completely different. Whenever we're adjusting the patient or realigning the bones of the spine in order to alleviate any type of nervous pressure, the procedure that we use in chiropractic is called an adjustment of the spine. There's a number of different ways that the spine can be adjusted. I'm going to show you the general protocol that we use here at the clinic in order to apply the adjustment in a nice, comfortable way, so the patient is nice and comfortable and we get the most benefit as far as from the adjustment itself. If we can have Miss Deborah please just go ahead and lie face down with your head up here on this nice clean paper for me, please, ma'am. And we're going to need you to just come down towards your feet just a little bit for me, please. A little bit more. Right about there looks pretty good, thank you. And just relax those arms, just relax for me. And that will allow the patient to receive the best benefit as far as from the adjustment. The type of adjustment that we're going to be utilizing today on Miss Deborah is going to be a Thompson pelvic realignment on the low back, as well as I'm going to utilize the activator instrument and adjust the thoracic and cervical spine, so we have a complete adjustment from top to bottom. The Thompson adjustment begins with just a simple leg check to find the imbalance of the patient. And we can see from when we look at her feet down in here, her right side is a little shorter than the left, which tells me the pelvis is tilted a little bit higher on the right versus the left. So we're going to bring that down first. And the way we accomplish that is with the table can come up just a little bit here. We're going to apply pressure right in this area. The table's going to make a lot of noise. Just another drop here. Once more. Then I always recheck the alignment, make sure we're going in the correct direction. Relax those legs for me. We already have a pretty significant difference down on the bottom. I look at patients in a global form, so we can't just look at the low back and stop there. So we're going to start right here at the base of the low back and use the activator adjustment. The activator is a gentle adjustment. Uses a spring-loaded instrument to gently put pressure on parts of the bone so we can put those back into their normal position, or as close to that normal position as the body will allow us at the time. Very simple, kind of sounds like a stapler, but we don't put any staples in anyone. Nothing that hurts, very comfortable adjustment. As I work my way up the spine, I feel for imbalances side to side. Find the segments that generally rotate according to how the low back or the pelvis was aligned in the first place. The other parts of the spine generally compensate for those changes. We work our way all the way up. And we finish off way at the top to align the atlas and axis, very two top bones that support the base of the skull. Also deal a lot with neck problems and headaches. And to finish off, we always make sure that everyone's nice and even and balance as much as they can at the end of the adjustment.
Massage is a very light gliding strokes that we do on a patient's back. It's supposed to be for relaxing. And you always want to ask, how's the pressure? How's the pressure for you? Good. When doing Swedish massage, there's different motions that we could do. That way we can target all the muscles on the patient's back. Typically we do this prior to the to going deeper work. Because if you start going too deep at first, it's uncomfortable for the patient. Okay. If the patient is having some sort of pain in certain areas, there's different things that we can do. One of the things is neuromuscular re-education, and the other is myofascial. Neuromuscular re-education is it's basically about trigger point therapy, and we help relieve nerve endings that's firing off quicker, and I'll show you how that works. So, are you having any joint pains right now?
No.
Okay. Well, after.
Oh, am I supposed to?
So I'm going to go with my thumb. Typically, we bring when doing neuromuscular massage, we want to guide our thumb over a certain area to see if they have any certain areas of pain. Okay. Is it right there?
Mm-hmm.
Okay. So right over here, she has pain. When we do trigger point massage, we want to hold the area that's hurting her. We're going to hold it for a few seconds. We're going to ask the patient to please take a deep breath. Hold it for a second and then relax. And what that does, it helps. It gives oxygen to the area, and it helps blood flow. And sometimes that takes away the pain. Sometimes that doesn't only take away the pain. Sometimes it helps, but it's not the only solution. So for this instance, how does that feel once you took a deep breath?
A little better.
A little better? Okay. There might be some areas that we do that it doesn't take away the pain. So now we'll go a little bit in medial, and we'll go up. So it hurts right there?
Mm-hmm.
Okay. So right here above the shoulder, a lot of people that have been involved in auto accidents or people that do a lot of typing or computer work, they have a lot of pain in their upper traps, their shoulders, and their lower back because they've been sitting down and their hands are flexed. When you have pain in a certain area, the nerve ending is sending off a signal in that area, and it causes more pain, and it's more stimulus. So what happens is with neuromuscular re-education, we aggravate that nerve ending by putting our thumb into the point that it fires off so fast that the nerve ending starts to fatigue. It's almost like holding a bowling ball, or better yet, a gallon of milk. A gallon of milk doesn't weigh that much, but if you hold it long enough, the gallon of milk will eventually feel very heavy, and your arm will relax and you'll drop the milk. So with neuromuscular, it's the same idea. She's having pain in a certain area. I'm aggravating that nerve ending by applying more stimulus, which is the pressure of my thumb, and it's making that nerve ending fire off so fast that the pain initially gets stronger, but then it diminishes because it fatigues. The nervous system is like an electrical current. It works like electrical current. If you have pain in an area and we apply pressure every time you come in, it's going to look for the least resistance. So if every time a patient came in, we applied pressure to a certain area, after a while, the nerve ending, the pain will stop sending signals to that area because it's being aggravated every time. Hence, the pain eventually will go away. Okay, and then there's different. When doing neuromuscular re-education, there's different things that we can do in order to help the pain go away faster. I'll demonstrate that now. Tell me if it hurts. Okay. So one of the things that we can do is active and passive stretching, or range of motion, like movement treatment. Now the patient has to relax. If the patient helps you, it defeats the purpose. The primary idea behind your nervous system is the flex your muscles to contract. If I passively, contract your muscle without you helping me, or without the patient helping me, it sends the your mind sends the nervous system a signal saying, oh, well, we're flexing, we're flexing now, and it should be, and it starts sending this, it stops sending the signal to that nerve ending, because it confuses the nervous system, because its primary function is to flex. But if you do it for the patient without them helping you, the pain goes away much faster, because it stops shooting the signal. Alright, so we'll try that. Tell me where it hurts. Right there. Okay, so I'm going to passively shorten the muscle for the patient. She can't help me. And I'll tell her, take a deep breath, please. And then relax. And some of the pain decreases and goes away.
Yeah.
It's gone?
Mm-hmm.
Okay. And basically, we're gonna want to do this in different areas, because if one side hurts, that means she's probably compensating with the other side as well. When we're lifting things or doing certain things to avoid pain. Right there hurts.
Mm-hmm.
Deep breath in. Until that pain decreases and goes away.
Oh no.
Good. Sometimes they feel pain here, and then we also check the cervical region, because the muscle that controls this is the trapezius muscle, and it connects from up here, it goes down here, and it goes all the way down to the T12, to T12. That's the lower, the last vertebrae on the thoracic spine. So we're visiting here, okay? Okay. And we'll just keep doing that same technique, going down her spine, and see if there's any areas that are hurting as well. Okay. A lot of times, outside where the thoracic, they might not have pain, but then a lot of after neuromuscular massage, we want to go into myofascial. Myofascial is like Swedish massage, but just deeper. Everything inside is connected by fascia, and sometimes when you have any adhesions or any trauma due to an accident or something of that nature, it kind of bunches up. So with doing myofascial massage, it helps to relax that and flush out any toxins that you may be storing as well. With this, when you go more in an angle, go deeper, and you can feel it moving under your hands. A little bit deeper work. And how's the pressure? And you can do myofascial in different parts of the back as well. Sometimes patients have a lot of lumbar pain,